And thank you to all of you for being here today and sharing your lunch hour with me. I know this is an important topic, but so is lunch. And I very much appreciate that you're here to discuss something that I hope that will be beneficial as we all go into the 2022-23 recruitment cycle. So today we're going to talk about and provide an overview of implicit bias, something that I know that everyone on this Zoom is familiar with, but it's always worth revisiting, especially as things need to be refreshed as we look into bringing in new talent and excellence to the UCI School of Medicine. We'll talk about common types of biases in the rating and evaluation of candidates, opportunities to mitigate personal and systemic bias, as well as the holistic recruitment processes based on some tried and true resources available through the AAMC and others. And then, of course, we will end with some additional resources that you can utilize and have at your fingertips to serve as support as you reflect on your own implicit bias, as well as opportunities, once again, to mitigate that in the work that we all do. So first and foremost, it's important that we all recognize that we all have biases. That's important as within the conversation to think about what implicit bias is, how we can make sure that we're doing everything we can to mitigate that, and understand that implicit bias, also known as unconscious bias, refers to social stereotypes about certain groups, the individuals from outside of their own conscious awareness. Early humans depended heavily on the ability to quickly distinguish a friend from a threat, and this trait still remains to this day in the form of bias. Implicit biases can be formed toward any social group for almost any reason. Implicit bias is a byproduct of processes that assist each of us in how we navigate through the world every single day. Bias acknowledges the way that we perceive, reason, remember life's experiences, and also make decisions. The challenge of implicit bias is that it can negatively impact our interactions with each other, as well as impact decision-making, which can contribute to discriminatory practices. The challenge of that, of course, as we're looking into the recruitment cycles, we want to make sure we do everything that we can to become aware of our own bias at the table and implement processes and practices to mitigate bias to ensure that those the decisions that we do have to make are equitable and inclusive of all who we interact with. Having bias does not make us prejudiced by any means. It really makes us human. And this reality is not an excuse for us, but it's an opportunity to gain personal awareness and pivot our thinking and behavior towards more equitable and inclusive practices. And so I'm hoping that's what we have an opportunity to do today, once again, with increased awareness, so we can mitigate the potential negative effects of biases, once again, that we all absolutely bring to the table. When we think about bias and where bias can exist, here are some examples of where bias can rear its ugly head. Of course, some of these may seem very obvious, but there's others that perhaps we never thought about impacting the way that we review applications, the way that we see candidates, and maybe even the way that we interact with each other. So this is just some examples of how we often in our minds through implicit bias are making constant categorizations of who's in, who's out, who's similar to us, and who also may be different from us. So there's many, many more ways that bias can show up, but here are just some examples that, once again, may be very common to us in our everyday life and the way that we navigate through the world, we interact with others, and once again, the way that we interpret information. What we do understand is that implicit bias comes in two forms. The first is explicit or conscious bias. The second is implicit or unconscious bias. I love the reference of the iceberg image that you can see to the right there. That really highlights the impact. Of course, when we think of an iceberg, oftentimes we make an association, a negative association of what the Titanic went through, right? They only saw what was above the surface, but they had no idea what was happening below until it was too late. So if we think about implicit bias from that perspective, you know, it's not just about what we can see on the surface, right? That's what's conscious, that's what we know, we're aware of, specific feelings and attitudes. Our behavior is conducted with intent, and it can be expressed in many ways, but once again, it's all very aware in the way that we navigate through our work. When we think about the unconscious side, that's once again what's happening below the surface that we're not aware of, others may not be aware of until once again that is coming out through interactions, decision making, as well as communication. So Implicit bias, or what's happening below the surface, is what's happening outside of our awareness. And that's why it's so critical that we do what we can to make sure that we become aware of what's happening below the surface, to make sure that we're not allowing any positive or negative interactions to impact our decision-making when it comes, once again, to the work that we do. So our goal here is to increase awareness of what is unconscious or below the surface, that we can illuminate that to ourselves to ensure we can make whatever adaptations we need to make to align our behavior, our interactions, and our decision-making with our spouse values and beliefs. When we think of implicit social categories and how implicit bias has been shaped, we understand is that priming can begin as early as 3 or 4 years old. We begin to categorize those around us and start to favor groups, primarily our family at the very beginning of life, right? Because that's who we know, who we're around. And the messages that we receive invade our conscious and unconsciousness and impact the way that we view and interact with others. And they often tend to strengthen over time. This can impact, once again, as we think about those early beginnings from personal experiences, from culture, from media, our exposure to religion, our exposure to education, and those that are within our social groups can shape the way that ultimately we form stereotypes, and once again, can shape implicit bias. And as we talked about from the very beginning, the concept of bias is really for our mind to help us manage cognitive load. We get so much information and messages coming in at one time. Our mind is trying to help us make sense of this information and minimize it so we can make decisions and move forward and avoid any kind of threat or conflict. But in that minimizing of information to help us navigate through the world, bias can show up. We understand it's a strong predictor of behavior. We also understand that in implicit bias, we have a tendency to revert to group stereotypes. That we review someone or think of someone as being different than ourselves or outside of what we know as us versus them. And also we understand that stress or limited time constraints can really amplify our ability to kind of revert back to depending on stereotypes as opposed to independent, reflective, and thoughtful approaches to our thinking. This, once again, can impact how we make decisions on who gets a job, who gets disciplined, or who gets promoted, who we choose to develop, or who we see as a confident or perhaps even a suitable mentee, or whose ideas we give consideration to. So once again, as the brain is helping us to understand and process complex and unfamiliar information, it is trying to help us simplify the information and to reduce, once again, cognitive load. So what we have to do is to make sure that we do everything we can to be aware of those underlying unconscious stereotypes that we may have because of our early beginnings and experiences to ensure that those underlying issues are not impacting how, once again, we make decisions, how we view others, and that we look at individuals from an individual perspective as opposed to a collective perspective. So where can bias show up as we look forward to the recruitment cycle for 2022, 2023? There are many things that we may recognize on the screen as we see when we're interacting with individuals. Of course, we understand our last cycle was virtual, as this upcoming cycle will be. And so it's important to understand these types of things that may appear when we're interacting with a candidate virtually through an interview or perhaps reviewing application materials that can show up in bias that comes from commonalities from someone who comes from your alma mater. It can come from someone perhaps who has a very similar parental status as you have. Perhaps it's nonverbal cues or body language that someone expresses that you have a bias towards. Perhaps it's someone's name. Perhaps it's also someone's virtual environment, whether that's positive or perhaps not so positive. And it also could show up in the terms of language fluency and or accent. So these are things that we may not even be thinking about, and unconsciously we're already making judgments or decisions based on whether we think a candidate has worthiness or lack of worthiness or fit or not fit when it comes to looking at candidates. And so once again, this is an opportunity to evaluate how do we address implicit bias to ensure that those unconscious decisions, rules, and allocations that we're making based on our biases to just some examples of what we see on the screen to ensure that that doesn't negatively impact someone for holistic consideration. So there's some type of biases that often show up in the rating and evaluation of candidates. Here are 7 very common types that if we all do a little bit of soul searching and reflecting, we'll likely find that we may have been guilty of at one time or another in the review and selection of candidates for residency and or fellowship opportunities. So the first is affinity bias. This is our tendency to favor candidates who have a similar connection or who perhaps have something, a shared experience that we may have. And so we have to be mindful of that as we're rating and evaluating candidates. Once again, whether that's in the selection process, in the interview process, or ultimately the ranking process. There's also attribution bias, in which we tend to judge others based on past actions or behavior, whether that be positive or negative. There's also confirmation bias, where we look for and or favor information that confirms positive or negative assessment that we may have made in the review of a candidate's interview and or application materials. And then we find ourselves seeking out validation to confirm that bias that we have either for or not in favor of a candidate's candidacy for our programs. Beauty bias, an association of good looks, and those good looks perhaps are associated with because this individual is perhaps very pleasing to the eye, then they bring with those good looks talent perhaps, opportunities to be successful, and also make an impact through positive qualifications without necessarily really looking deep into what the applicant actually brings to the table in terms of their materials, the way they present themselves, and the way that they're able to communicate as part of the interview process. So that often can show up when we have pictures as part of our application profiles, as many of the application processes do. So we have to be very mindful and take an opportunity to kind of pause when we may find ourselves being swayed by the perception or the beauty of someone that we may see in a picture as part of the application process. There's also conformity bias, which refers often to as groupthink. Basically, if there's perhaps a majority perspective or positive or negative impact of a particular candidate, we find ourselves kind of being swayed toward the views of the opinions of other people in the group, as opposed to really doing our own independent reflection of the particular candidate's ability to be successful or a fit for our program as well. And then our last two, the horn and or halo effect, basically an opportunity to look at a candidate either negatively or positively based on attributes about the candidates that can overshadow our opinions or our application. So essentially, if we either form a negative or a positive attribute about a candidate, that may overshadow the entire perspective without really looking at the candidate independently and also objectively, not necessarily getting stuck in one particular area, because we understand that negative or positive attribute may have come from a point of bias. And we want to make sure that we are subjective once again, and that we discuss if there's points that come up in an application that need to be discussed, but they don't necessarily overshadow the entire candidate's application. And then last but not least, contrast effect can be an opportunity where we compare perhaps the CV or the interview of one candidate in contrast to the candidate we may have seen before, instead of really aligning with our rubrics to ensure that we're giving that candidate a fair assessment and reviewing that individual who is in front of us appropriately, as opposed to in comparison to another candidate. So these are just some common ways that show up in the literature of where bias can really, once again, present itself when it comes to rating and evaluation of candidates. And oftentimes just having an awareness, doing a quick review of some of these bias points can help us really be mindful as we're going through application materials, as we are interviewing candidates, and once again, as we're engaging in discussions with our colleagues about which candidates we intend to rank and why, to ensure that we're doing our kind of check at the door and ensuring that we're checking our own bias before we engage in conversations that once again impact decision making and once again have the opportunity to negatively impact candidates. So where can systemic bias show up? We've so far talked about the importance of checking your own personal bias at the door. We also understand there are systemic things that are in place that we may have reviewed or may not have had an opportunity to review that could have an opportunity to incorporate bias that impacts candidates, as well as the way that we do our work to increase diversity, equity, inclusion within UCI. We want to make sure that we're doing everything we can to address our personal biases, but also ensuring that we're looking at our programs, our practices, and our policies. So ways that can show up, we see here, outreach and recruitment practices. Where are we engaging in work to be visible to candidates who may bring enhanced diversity to our programs? And we'll talk about some ways that we can maximize those opportunities in a few later slides. Application materials, how are we looking at the application materials holistically? The selection process, are we ensuring that we have diverse candidates that are participating in the selection process? Are we using rubrics? As well as the interview process. Have we done our due diligence in ensuring that we have looked at resources that help us understand how implicit bias can show up in the virtual interviewing process? So a lot of things that we can do step by step before we even see our first application or interview our first candidate to ensure that we're doing everything we can to mitigate bias in the outreach recruitment and selection process, as well as the interview process. And the AAMC has a wonderful set of guidelines for the 22-23 residency cycle that I'll reference a little bit later, but also is linked within this slide as well. So what are some ways that we can mitigate personal and systemic biases as a whole? So of course, one of the things that we're doing today is talking about implicit bias training. And as much as we all may know about implicit bias, it really is important that every single year we are refreshing our knowledge and awareness, that we're being intentional in bringing this to the table before we engage in the recruitment and selection of our new candidates for the upcoming cycle, because things can get rusty. And it's also important to understand that we're incorporating all the different ways that things have changed in the recruitment process, such as, a few years ago, we would have had candidates come in person perhaps, or maybe there was a hybrid opportunity, but due to the pandemic, we all moved to a virtual environment. And because of that, we have to take in consideration the impact of the change in our environment and where, once again, does bias continue to creep in, and how do we do everything we can to mitigate that? So as we think about implicit bias training, of course, when we talk about the very beginning of the process, of course, it's not just looking at applications, it's engaging in outreach to, once again, increase the visibility and communicate to diverse candidates that UC Irvine is a place that you want to be. It is a place that you can thrive. Is it a place that you will be welcomed, and that you have a place to develop and train and be supported in your next steps. And so that comes through intentional outreach, whether that's opportunities such as virtual rotations or shadowing, engaging with organizations that are intentionally supporting diverse candidates, specifically URIMs, underrepresented students or applicants in medicine, providing opportunities to engage and welcome and invite individuals to view what we have to offer at UC Irvine through residency open houses that are targeted towards all candidates, but specifically ensuring that our historically marginalized communities understand that they will have a place they can once again be and thrive, that we incorporate social media, and that we give our current trainees and opportunities to engage and celebrate our diversity initiatives, our outreach opportunities, training, and then also, highlight what life will be like as a candidate here in Irvine as part of the UCI family. So we have opportunities, once again, to mitigate systemic bias by being intentional in the work that we do and not coming from a perspective of if we build it, they will come, but that we need to be intentional and meet individuals where they are and be transparent about what we have to offer at our institution. Additionally, a holistic review and selection is a very key component of the work that we do. We want to make sure that we incorporate equitable review when it comes to GPA, USMLE score cutoffs. This probably would have been more of an impact related to those who are taking the exam before pass fail, but also be mindful of how we're filtering candidates. And I understand that sometimes, there's only a few, a small but mighty group that will be reviewing applications, and there's a lot to go through. So sometimes those cutoffs and filters help make that process a little bit more manageable, but it really is worth the extra time and the effort to make sure that excellent candidates are not being missed by unfair score cutoffs, as well as unfair bias that often shows up in candidacy for individuals who are involved in Alpha Omega Alpha or AOA membership. The AAMC provides some wonderful resources through their EACM model, which refers to experiences, attributes, competencies, and metrics, and including a holistic review in the application materials to look at each component, as well as the distance traveled and what an applicant is bringing to the table and what they have been through to get to where they are to be in front of you as a program. And then, of course, scoring rubrics, another recommendation that comes out of the AAMC's holistic review models that really helps ensure that everyone is looking at every single candidate equitably and in the same way. And that will help strengthen your conversations, as well as justify why you are making a decision on ranking one candidate as opposed to not ranking another candidate that may have been come through the interview process. And then last but not least, as part of holistic interviews, once again, some wonderful resources that help us and support us in navigating through the interview process in a virtual format, how to make sure that we're ranking holistically as well, and that we're bringing all key players to the table. And key players just means everyone who has an opportunity or is available to participate in the interview process, and that as part of that selection, including individuals who are diverse, not just in their representation and how they identify, but also diverse as far as their position within the institution. So that includes faculty members, trainees, staff participation, and also being intentional about the importance of diversity and inclusion at UCI. That should be communicated as part of the interview day and an opportunity for all candidates to express how they intend to contribute to our commitment to diversity, equity, inclusion, and overall inclusive excellence in medicine at the UCI School of Medicine. So when we think about, once again, that iceberg and what we can see on the surface as opposed to what's lurking beneath the waters and that we want to be mindful of, oftentimes that first step is really about our own individual personal awareness and acknowledgement. And at the very beginning, we started out the presentation acknowledging that all of us bring bias to the table. It does not make us prejudiced. It does not make us bad people. It makes us human. And so our goal is to do what we can to increase our personal awareness and acknowledge what biases we bring to the table that we may not be aware of. And so we need a little bit of help with that. And so one way to do that is through the taking of an implicit association test through Project Implicit. And I'm going to provide an opportunity a little bit later in the presentation where you can reference that. And in your own time, take about 10 to 15 minutes to take one of these implicit bias tests. They come in many different ways, but you really may find yourself surprised where bias will show up in these tests. And so they're quick, they're easy, they're confidential. I don't get a record of it. No one gets a record of it. It's just for you and your own awareness, and also an opportunity for you to start to make adjustments where they need to be made, sure that they're not impacting the work that we do in the selection process. Additionally, research supports that as we begin to become aware of our biases and we recognize and acknowledge, we have an opportunity to be reflective and mitigate the influence of this bias on how we interact with each other, but also, once again, that key piece, which is decision making. Also, recommendations include practicing mindfulness. in adopting reflective practices. And what we have to acknowledge about being reflective is that it takes time to be reflective. It's hard to be reflective when you're busy. And I recognize and acknowledge that all of us are busy. And so we understand that in being mindful, we need to be intentional about scheduling time to be reflective. That could be through taking time out to just kind of take a break, to meditate, take an adult time out, and also interrupt biased thoughts as they may come up as we're reviewing applications or as we may be interacting with someone, to make sure that we're being deliberate in our decision making and how we're processing information. So as those things come up, that we understand, well, wait a minute, where did that come from? Where does that thought come from? Why am I thinking about this particular candidate based on what I've read, seen, or heard, as opposed to another candidate? And so it's that taking that time out to say, I need to kind of stop, reflect, or perhaps give myself time after an experience, after review of an application, or after an interview, to really be reflective of what is coming up for me personally, and where is that coming from, and how do I address that? And then as we do so, we will find ourselves being more empathetic and compassionate about the distance traveled of individuals perhaps and who is in front of us that may have had a different pathway than maybe the traditional candidate, and understanding that, you know, this person has an opportunity to add something based on that resiliency or experience, lived experience that they bring to the table that may look a little bit different, but how powerful will that be able to be in impacting our program and the way that we do our work, and ultimately the patients that we will serve. And then last but not least, we all should be facilitating opportunities to engage and dialogue with each other. So that's continued opportunities to, engage and interact with diverse individuals, diverse communities, diverse patients, and be intentional in that effort. And as an institution, and in my work, my goal is to ensure that I'm doing everything that I can to create opportunities where we can provide mentoring and support, that we can energize and amplify those who really are serving as our diversity champions in our departments and in the institution, and that we're creating opportunities where individuals can feel included and ultimately feel a sense of belonging, because that is what's going to help individuals feel engaged, help support continued retention. People will continue to enjoy the environments that they work in, and that they'll be more likely to communicate that and share it with others who ultimately may be interested in the future and coming to UCI. So the work really does start with ourselves. And so I'm really just, once again, thankful that you chose to spend your hour with me to talk about how we can once again do our work, so that we ultimately can be more impactful in the work that we do in mitigating bias for others. Here's some additional perspectives and opportunities to mitigate implicit bias or unconscious bias that we can put into place when we feel that these things are coming up, or we find that there's perhaps a negative stereotype that comes to mind, or perhaps a negative perspective, or just a different perspective that we didn't necessarily expect, or perhaps someone challenges a comment that we make in the review or evaluation of a candidate, and we're not quite sure why we had a particular perspective to begin with, and we're kind of thrown off by that. So here's just some ways that we can, once again, provide an opportunity to mitigate bias. One could be through stereotype replacement, where we acknowledge a response that maybe we had was on an automatic stereotype, and we reflect on, why did I say that, or where did that come from? And then we consciously adjust to make a non-stereotypical response. So it really is kind of replacing the negative with a positive, after we do kind of a little bit of reflection on the kind of why and where. We also can look towards counter-stereotypic imaging, where basically we imagine an individual as the opposite of the stereotype and increase exposure to counter-stereotypic individuals. This could be an example of perhaps inviting a renowned African-American research scientist to provide a grand rounds presentation. So that kind of goes against perhaps the stereotype that individuals of color aren't traditionally physicians, or females aren't traditionally research scientists or physicians. So just ways that we have an opportunity to be intentional in the work, to replace what may be the traditional norm or standard with something different, to allow us to engage in a different exposure experience, but also those who are interacting with the individual have an opportunity to engage in seeing something different as well. Also, perspective taking. This is kind of an old try and true, put yourself in someone else's shoes and to just, once again, be empathetic of what someone else's experience may have been in getting to where they are. And oftentimes when we do that, we have an opportunity to kind of get outside of our own perspective or vantage point and reflect on how someone else may feel and appreciate what they're bringing to the table in terms of their application and or their experience in interviewing. Intentional group diversification, we talked a little bit about this already, basically expanding our networks to include diverse individuals, whether that be in our work life or in our home life, to include individuals who may be of different race or ethnicities, identities, orientations, or even abilities. And that, once again, intentionality of diversifying who we know, who we work with, who we engage with in and outside of work, really can increase our opportunities to become more knowledgeable about cultural humility, but also more aware of our bias and or opportunities to be more reflective of the experiences and lives of others. And then last but not least, opportunity to recognize situations that magnify stereotyping and bias. At the very beginning, we talked about the importance and how bias can often expand if we are under stressful conditions and we have time constraints. So one thing that we can do very intentionally is making sure, for example, if we're interviewing or we're reviewing application materials, that we allot dedicated time to do those things and we aren't trying to multitask, as opposed to when we often probably do that on a daily basis. We're doing 20 different things at one time, but it really behooves you as a reviewer or evaluator, take time out specifically for the process of evaluating applications, or specifically take time out when you're interviewing to have time either before or after an interview to reflect, to make sure you have ample time to review materials and that you're going into the process fresh. And do your candidates a favor and offer everyone that same opportunity. If you have them back to back, try to ensure that in the administration process or the operational process that you're allocating time to have in between candidates just to give yourself time to process all that you've seen and heard, but also I'm sure that your candidates will appreciate that they will get a more authentic you and a more prepared you in the recruitment process. Some resources that come out as far as best practices in the recruitment and selection of candidates include the importance, once again, of cultivating relationships. We can't say enough that the recruitment and selection process does not come down to when we receive applications. It really is about what we're doing and how we are being intentional to engage outside of the organization well ahead of time, engaging with underrepresented in medicine communities, engaging with communities that we may find aren't highly represented in our programs, engaging in residency fairs, open house, virtual meets and greets, all those types of things to, once again, increase visibility, to be able to communicate from our perspective what diversity, equity, and inclusion and belonging means to us at UCI, as opposed to letting candidates assume what that means. So we have to tell candidates why this is important to us, how it's important to us, and then show them when they actually visit us if offered an interview as part of the selection process, and visit us virtually as we look forward to the 22-23 year. But that's a wonderful way to do that as well. It also gives us an opportunity to utilize social media to highlight our program's strengths, resident experiences, and life in Orange County or Irvine in particular. We also, once again, have an opportunity to highlight our program's commitment to diversity and ongoing efforts to ensure an inclusive environment. And that's really hard to do if we wait until the interview process or the review of the application process to do that. Because oftentimes those perceptions are formed and shaped well in advance of individuals submitting their application to us. So we really have to be intentional and do our work in advance. Some additional recommendations include pre-screening areas to include applicants who meet program requirements regardless of their background. We already talked about the importance of being mindful of USMLE cutoffs and where that fits as far as the scale of evaluation practices, as well as AOA status. potentially hosting metric bias interviews, consider separating screeners from interviewers to mitigate bias to things such as board scores as appropriate when they existed, as well as also providing opportunities, even maybe even consideration of not having images if you would like to try that as a way to kind of minimize bias if you think that that could be a potential concern within your department. And the last two things, one's to standardize interviews. We talk a lot about that. Of course, the importance of having standardized questions so that everyone's being asked the same question, and consider a time allotment for interviews. If everyone gets 30 minutes, then ensure that everyone gets 30 minutes as opposed to some getting 30, some getting 15, or some getting an hour, or whatever the case may be based on your actual interview protocol. And then of course, utilizing a rubric that reflects the assessment that your department has done as part of the perhaps EACM model, the AAMC's EACM model, and then be mindful and perhaps even consider including culturally relevant resources and necessities. So if that could be as simple as, where would someone eat who was interested perhaps in diverse food, or where would someone go and get, their hair care or other things that they may need that reflect our sensitivity to cultural humility and the importance of the diverse community that we will serve in our patient care, but also in those who are part of our family, our UCI family. And then we talked about the very beginning, also at the beginning of this slide, the importance of outreach and being present specifically in front of diverse communities. But we really have to be clear in our recruitment and advertising that diverse applicants are encouraged to apply and are welcome. That doesn't necessarily mean we're recruiting based on race and ethnicity. It just means we're saying diversity is valued here. And we need to say that, and that needs to show up somewhere on our website. It needs to be in our materials so that students who may be, or applicants who may be considering diversity as part of their consideration for programs, they don't have to hunt and search and find to identify whether this will be a place that they belong. So whatever we can do to be clear about our mission, our diversity goals, our activities to incorporate inclusiveness in our programs will be a positive thing for candidates who may represent the URIM or other underrepresented categories. So when we think about the holistic review stages of selection, this is where we have an opportunity to kind of shift towards what the AAMC provides in terms of holistic review. We think about holistic review in 3 stages. The first is the screening stage, the second is interviewing, and the third is our rank order list. We understand through the match process, these things don't always align. Who we want may not always be who we ultimately receive as part of the match process, but we do have an opportunity to go in upfront to ensure that we're providing everyone individual consideration and reflection of our mission and diversity initiatives. And also we're having a balanced approach that is equitable for each candidate when we're considering what they bring to the table in terms of their experiences, their attributes, their competencies, as well as the metrics that they bring to the table, as we will look at a little bit further in depth related to the AAMC's model. So the AAMC very much refers to holistic review and being a flexible, individualized way of assessing candidates' abilities. And I love the word flexible and individualized because this really means that as a department or a program, you have the opportunity to use a model that we'll discuss next to really identify what are the competencies that are needed in relation to what you're looking for in terms of your candidates. What are the competencies? What are the metrics? What are the experiences? What are the attributes? And you get a chance up front to talk about what you want that to look like. And then the AAMC provides a method in which to utilize those conversations and formalize it in a way that you can use so that everyone can go through and ensure that they are doing everything that they can in the selection, the recruitment, and the interview process to mitigate bias, because you're being as equitable and fair as we can, once again, once we've already done the best that we can in our own work. So this model for holistic GME selection, and once again, we're often referred to as EACM, refers to experiences, attributes, competencies, and metrics. And as we break that down, kind of the inner ring of experiences is broken down into experiences that encompass the path an applicant has taken to get to where they are. in front of you. The outer ring refers to the acknowledging the influence of the world context in which the experiences took place. So whether they come from a disadvantaged background, whether they are historically underrepresented in medicine. And then the inner ring referring to what are the experiences that they have intentionally engaged in as a medical student to ensure that they are coming to the application process as prepared as possible. So that could be a combination of leadership experience. It could be experience with diverse populations. It could be service. It could be healthcare experience beyond their medical school training. So you can determine what you want that to look like as a program, but there are some parameters that allows you to kind of shape what those major categories will be. And then underneath those categories, you have an opportunity as a department or a program to go in and say, okay, we value leadership roles. We'd love to see leadership opportunities that are shaped by this type of experience, or research experience that's shaped by this type of experience. So a lot of flexibility, which once again is where the AAMC is coming from when they refer to that holistic review, an opportunity to be flexible and individual based on how you will rank and how you will evaluate candidates. When we look at attributes, these are more referring to a candidate's current skills and abilities, their personal qualities, and any relevant demographic factors, either to us in Orange County or the specialty. But once again, here we want to understand, how do they work well with others? How do they bring any language proficiencies or talents to the table? How have they demonstrated cultural humility and or competency? And then what is their professional stature? For example. So many ways, once again, that we can look at attributes here, and we can also add other things into attributes that we may want to evaluate as part of the selection of candidates. Competencies, this once again is referring to that kind of core reflection on the skills and also how a candidate may process information, how they think, achieve results, interact with people. And that can show up in terms of their interpersonal and communication skills, their medical knowledge, professionalism, that can come from many parts of their application, as well as how they communicate their experiences in an interview as well. So once again, another opportunity, another layer to look at candidates, once again, more holistically. And the metrics, the very common metrics, of course, that we often are aware of and we think of often when we think of evaluating candidates are kind of those, the core of the AACM model. And once again, we're not looking at these metrics exclusively, but in concert with the experiences and the attributes and the competencies. And these refer more towards the dean letters, USMLE exam scores in the past, or pass-fail, moving forward, publications, presentations, and then of course, overall GPA. And so here, as we talked about earlier, it's important to be mindful that these metrics don't overshadow the entire application, but also this is a place often where we can find that biases can come into place that we need to be mindful of, not overemphasizing one particular area over another, or overemphasizing metrics as opposed to the experience, the attributes, and the competencies an individual may bring to the table. So we understand about standardizing an applicant criteria for rubrics in reflection of the EACM model, is the AAMC provides literally a sheet that you can use if you haven't engaged in this conversation as a department or a program, to really start the process for defining how holistic review is going to look like in your department, and how that's going to be aligned with a designated rubric to allow those who are participating in the selection process or the interview process to be able to go through and actually kind of rank order what is important, and then how much weight is going to be given to each of these categories. So the first step is to, of course, we've already talked about the importance of implicit bias training, and that kind of goes without saying for all parties involved, but you can utilize the AAMC applicant criteria identification and prioritization sheet to kind of help you identify of those core competencies of each mission-driven domain, how do you want that to contribute to the value of your program? You can once again also add in things, as I mentioned, that perhaps were not included, that you would like as far as criteria desired in your residency selection process, and then use the ranking sheet to inform how, once again, you want to assign value to each of those metrics, as well as whether you will invite a candidate to interview based on their overall assessment or overall scoring of their criteria on the rubric. So once again, it provides a uniform way for everyone to be on the same page. And then when you engage in discussions of one candidate versus another or an individual candidate, you'll be able to reference back to that particular document or your rubric to confirm either how you will move forward in interviewing a candidate or ranking a candidate or even selecting a candidate for an interview from the beginning. So when we talk about how do we understand which criteria is important as opposed to, well, they're all important, but how would you assess which one may be most important or what are they bringing to the table in terms of their EACM contributions? So for example, if leadership is a category on the rubric, you have an opportunity to rank, how important do we want to identify leadership as part of one of our EACM areas of importance on the application. So perhaps 1 is not important, 2 could be somewhat important, and 3 could be very important. So you would essentially go through each of those categories on the model to determine which one do you want to highlight for your particular program. So it doesn't have to be all of them, because you probably won't have an opportunity to assess all, but figure out what's key to your department, your program, and then assign points as to which one you want to incorporate and why or why not based on the point value that's assigned. The second step in building your rubric is, of course, review the rankings from part 1, which is basically where you look at the criteria, you determined which is important, which is not important. And then once you've eliminated those areas that are not important, you want to then assign those areas to each of the 4 domains. So either the experiences, attributes, competencies, or metrics. And then you want to do the work in defining what that means. And we'll provide an example next. You have an idea of what that could look like in practice. And then also identify what evidence will satisfy this requirement through the assessment. And so if you've already done this process and you already have a rubric, it may be a great practice before the application cycle comes up is to do a reflection piece and just figure out whether the current recruitment and selection materials that you have allow you to assess what it is that you're hoping to get in the ultimate recruitment of excellent candidates for the program or your department. And if there are any changes that need to be made, it's important to do that now and/or ensure that you are putting into place an opportunity to be reflective and revisit the policies and practices for the upcoming year. So an example from UME, the only difference between UME and GME as far as the AAMC's model is that the UME version does not have competencies yet, because our students at that point are in their medical school training, working to develop those competencies to be ready for the residency application process. But they do have the EAM model, which is the experiences, attributes, and metrics. So from that perspective, if we were to go through the rubric process, which probably seemed a lot more complicated in theory in this conversation as opposed to what it really could be like. If you look from an experience perspective, perhaps we are saying our criteria is that we want an individual to be considered for medical school admissions who has healthcare experience or clinical experience. And so for that, we've defined what that means. So essentially we're saying experience working in a healthcare setting, including but not limited to shadowing, or hospital experience, clinical exposure, perhaps hospice volunteering, or a position as a medic, scribe, RN, or CNA, et cetera. And so in order to assess whether that need has been met from an applicant's materials, we then will say, okay, an assessment scale can be a good applicant will have perhaps less than 6 months in a clinical setting. A better applicant from the terms of clinical experience will have 6 months to a year in a clinical setting. A better or the best candidate will have 1 year in a clinical setting with a letter of recommendation from a physician. So we have to be very mindful of how we're articulating and assessing each definition that we make for each criteria. So it's not good enough to say, okay, this person checks the box, they have clinical experience. No, break it down, because we know that every candidate is going to come with different experiences and a different background and different exposure. And so if we lump everyone together and we really don't kind of carve out how we will assess, it's really hard to differentiate the talents of each individual candidate. So this is just one example from UME, but it shows you that it's a lot easier to kind of visualize than it is to kind of talk through the process. But those resources are available through the AAMC and really do help kind of navigate through creating a rubric if you have not yet done that, or once again, utilize that model to really try to minimize bias and ensure that everyone who is participating in the selection process is coming from that perspective holistically, but also on the same page. So there are some recommendations that have come out through the University of California GME office for the 22-23 recruitment cycle. Some of this information probably has likely come down the pike to your departments and programs, but a few things I just wanted to highlight before we wrap up today. The first is that there's been a recommendation that all residency and fellowship programs must conduct interviews in any recruitment activity, including second looks, virtually. And that underlying kind of push for that really is to make sure that we are being equitable to all candidates and provide access to all candidates as part of the recruitment cycle. You should also know that UME is doing the same. All UME interviews are being held virtually, at least for the UCI School of Medicine. Hybrid interviewing, which is basically a combination of virtual and in-person interviews in the same year of a program, is recommended to not be permitted because of the risk, once again, of creating inequities in applicants' access to resources and abilities to visit in person. And then programs are encouraged to share their interview process with applicants as soon as possible to minimize any stress, promote well-being, and of course, increase opportunities to have transparency with our future candidates. And then another recommendation, of course, is to refer to anti-bias practices to the AAMC. There's a wonderful website that has information on unconscious bias resources. We'll talk about a few others as well before we wrap up. The holistic review model that we've talked about is available also on the AAMC, the EAC model. And then, of course, referring to the NRMP Code of Conduct Guidelines, which, of course, should be followed through the application interview, matching and onboarding process. So just once again, ensuring that we're all up to speed and refreshed on guidelines that really are there to help us navigate through this process a lot easier. I know sometimes it could be a little painful to start because it takes work to kind of get ready and to ramp up for the process of recruitment and selection. But if we do that work in advance, it really is there to kind of help ensure ease of the process, equitability of the process, and also once again, provide a point of reference should we need to engage in further discussions. So one of the last resources I wanted to highlight, of course, was the Project Implicit's Implicit Association Test, which I mentioned a little bit earlier in the presentation. The Implicit Association Test really is a proven technique for enhancing awareness of one's unconscious bias in the Implicit Association Test, or the IAT. The test measures the reaction time of individuals to a series of words or pictures presented on a computer screen, centered on social attitudes to race, gender, age, sexuality, weight, disability, etc. And it really can help us reduce negative effect of implicit bias by, once again, increasing our awareness. And once again, no one gets to see your results. It's all in confidence, but it's a very quick, easy way, just once again, to begin that personal conversation with yourself to identify where may I have bias that I may not be aware of, or in relation to that iceberg, what do I have going on below the surface that I need to make sure that I check at the door, address, and reframe and pivot to go a different direction to ensure that as I'm interacting with diverse candidates, as we all hope that we have a robust amount of diverse candidates, that I'm not negatively impacting anyone because of my own bias. Wonderful resources that I believe I may have shared in the past, but are worth revisiting. The university has Implicit Association for those who may be overseeing and in leadership roles, but anyone can engage in any one of these 6 e-courses. They can be done out of order, and they typically take anywhere from 5 to 10 minutes, maybe 15 minutes max. So it doesn't take a ton of your time. And once again, you can schedule time as you have time to take any one of these 6 areas that can really help us again do kind of above and beyond awareness of bias, but also how to mitigate and manage moving forward, specifically if you're overseeing and serving in a leadership capacity. Also, the AAMC release, I believe this was in 2021, addressing implicit bias in virtual interviews. There isn't an updated one, but I reviewed it recently and it still holds true to a lot of key concepts that will help, especially as we all move into virtual interviews once again for the upcoming cycle, to be aware once again of what bias we may bring to the table in terms of interviewing virtually. It could be very simple to perhaps someone doesn't have the best light, or someone's internet connection is maybe going in and out, right? We have to be sensitive that everyone does not have the same access to resources to places to interview that may have ample light, that may have strong bandwidth. And so when things like that come up, we have to be mindful of how we respond to that. Do we then say in our heads that this candidate is not off to a good start because their lighting isn't well, or because the Wi-Fi or bandwidth is freezing, or there's technical challenges? So those are things that we can be mindful of that perhaps we wouldn't have had to be mindful of before in terms of virtual interviewing. So last but not least, as we close out, the goal as we started at the very beginning really was to increase opportunities for awareness of our own bias that we bring to the table, acknowledging that we all bring bias to the table and that it doesn't make us bad people, but it does give us accountability that we need to do something about it, and be mindful, raise awareness, encourage dialogue. And we do that through continued conversations with each other and continued training. Consider taking an implicit association test, once again, in the comfort and safety of your own space, to be awareness of what bias you may be bringing to the table that you're not aware of. And then, of course, continued engagement in implicit bias trainings, but also implement and practice. It could be one strategy at a time to help mitigate bias, to ensure that we're doing all that we can to make UCI a place that people want to belong and to come and to thrive. And so at this time, I know we have just a few minutes left. If there are any questions I can answer, please feel free to ask them, but also know that I am a continued resource. If you have questions as an individual, as a department, I'm happy to collaborate to see how we can work together, ensure that we're amplifying your efforts to continue to diversify your spaces and bring the best and the brightest talent to UCI, but also to maintain and retain the best and the brightest talent at UCI. So I thank you all for your time, for your lunch hour, and thank you for your intentionality in the work that you will do moving forward, the recruitment and selection of diverse candidates. Any questions?
Thank you so much, Dr. Worsham. We will, we've recorded the session, so be sure to circulate it to the group. And we will also connect with Dr. Worsham and see if she has any other resources that she may think will be helpful for everybody. We'll be sure to circulate those as well.
Thank you so much, Courtney.
All right.